Greetings, class. As you can see, I'm kind of holed up in my kids' playroom. I've been in quarantine the last couple of days on the couch here in the kids' playroom. Been a little under the weather, but I thought this would be a good time to go ahead and knock out this week's discussion. And so it's going to be centered around the core value of communication. And so we'll focus on what nursing communication is and how it impacts our nursing care. And so to begin, we need to clearly define what communication is. And according to Oxford Languages Dictionary, communication is defined as the imparting or exchange of information. And nursing communication is a fundamental component of what we do, right? So how awkward would it be to go into a patient's room to do an assessment on them and not explain anything that we're getting ready to do? Just diving right in and start touching and grabbing. It would just be horrible, right? Same thing if you need to put an IV in somebody, or you've got to put an NG tube down a deaf person's ear. You've got to be able to figure out a way to communicate. And unless we know sign language, we're going to need some help with that and interpreting what we're doing. But basically, communication between the nurse and the patient, it needs to happen. Right? You got to always talk and tell your patients what you're doing. We need to always convey in a way that they understand, and for the main reasons that it calms their fears. Number one, it reduces anxiety and gives clarity to the situation as a whole. And I just always try to imagine myself in that position. It's me in that bed, and I'm talking to myself. What would I want my nurse to say to me? Right? And I think that's an easy way to make sure that I speak less in medical jargon terms, because as we know, most medical terminology just right over people's heads, right? So for the normal person anyway. But despite what some of us may think, communication isn't always easy. It isn't always cut and dry. And some people have a natural ability to communicate appropriately, but the rest of us, including me, we need a little help in the development of that skill. And as I'm going to say here, effective communication is a skill that needs to be developed just like anything else. And it can be affected by our attitudes, our personal feelings or emotions that are tied to a subject, and the amount of knowledge that we have on that topic. And most organizations, mine included, offer certain classes in communication development, and which that helps to hone in on the specific areas of the communication that needs more work. And with such an emphasis on bedside shift report, purposeful rounding, these are communication strategies for the patients. Understanding how to communicate to best serve the patient needs is a collaborative effort for all of us. While making sure that the patients have the best experience possible during hard times is a priority, effective communication amongst the team is also paramount. Certain components of communication can be challenging, especially those where discipline is concerned. And as mentioned earlier, most organizations offer education for communication skills. And for this area at my facility, we use a course called Crucial Conversations, which is geared toward learning how to take the emotion out of a conversation that needs to happen for correction purposes. But in conclusion, communication is not just between the nurse and the patient, but also between members of the team. And without effective communication, we risk disruption of the nurse-patient-family relationship that we tried so hard to build with that rapport. And so it's very important for us to be able to provide the best possible care and to achieve the best possible outcomes when we develop our communication skills and really hone in on what we need to do to develop them better. So, thanks for listening, and I look forward to watching some of your videos. Thank you.